I am a registered nurse, a former statewide union president who's fought for rights of workers and patients, and now is a candidate for Florida Senate District 21. In my 40 years of nursing, I've had the privilege of serving patients from all walks of life. I've been there in the ER, in the OR, in community clinics, and at the bedside of people in their most vulnerable moments. When someone puts their trust in you to care for them, there is no greater responsibility and no greater honor. But over these 4 decades, I've seen something deeply troubling. I've watched our healthcare system shift its focus away from care, compassion, and the well-being of our patients and towards profit margins, corporate interests, cost-cutting measures that have devastating effects on the people we serve. When I became a nurse, healthcare was fundamentally about the patient. Every decision we made revolved around what was best for their care and recovery. Unfortunately, in today's healthcare system, that truth is often overshadowed by another: profits. Over the years, I've watched as that focus shifted from patient care to the bottom line. Decisions about staffing, resources, and even the length of patient stay are increasingly influenced by financial considerations rather than what is best for the patient. This shift has real consequences. It means fewer nurses at the bedside, longer wait times in the emergency rooms, and ultimately lower quality of care. So patients over profits is not just a slogan for me. It's a call to action, a principle that has guided me throughout my career. It's what I've lived by in every hospital, clinic, and healthcare setting I've worked in. As nurses, we know firsthand the dangers of putting profits before people. I've seen what happens when healthcare becomes more about margins and less about nursing and medicine. When hospitals cut these costs by reducing staff, it's the patients who suffer. And when there are staff cuts, resources are stretched to the breaking point, and nurses are asked to do the impossible. So when hospitals put profits over patients, lives are at risk. And who suffers most? Our communities, our loved ones, our families. And when the focus is on profits, the humanity of healthcare is lost. This shift has led to a dangerous and often deadly consequence: the prioritization of profits over people. But, I didn't just sit back and accept this. As a union president, I fought for safe staffing levels, better working conditions for nurses, and the protection of our patients. I knew that when healthcare workers are supported, when they have time and resources and training, they need to do their jobs well. Patients get better care and outcomes improve. These experiences are what drove me to run for the Florida Senate in District 21, amongst others. Florida deserves leaders who understand the consequences of putting profits over patients and Medicare for all. Leaders who will stand up for our communities, advocate for working people, and protect our most vulnerable citizens. As your senator, I would fight for healthcare reform that ensures everyone has access to quality and affordable care. This also means fighting for safe staffing levels so nurses and healthcare professionals are not overwhelmed and can provide the best care possible. It means holding healthcare corporations accountable when they cut corners to boost their profits. And it means advocating for more transparency in healthcare pricing so that no one is blindsided by outrageous medical bills. I will also push for policies that expand the access to healthcare in rural and underserved communities, ensuring that everyone in Florida can get the care they need, no matter where they live. Healthcare is not a privilege. It's a basic human right. And I will work every day to ensure that rights are protected. Our healthcare system should reflect our values. It should put people first. It should treat every patient with dignity, compassion, and respect. But all too often we see that it does fall short of that ideal. So that's why we must act. That's why we need leaders like myself and Nate Douglas who understand healthcare. It's not just from the perspective of policy, but from the real lived experience of caring for patients. Leaders who know what it means to hold the hand of someone in pain, to fight for safe working conditions, and to stand up for what's right, even when it isn't easy. I'm ready to be that leader for you in the Florida Senate District 21, but you know I can't do this alone. Change doesn't come from one person. It comes from all of us standing together and demanding better care. It comes from all of us saying enough is enough. We need a healthcare system that prioritizes Medicare for all and patients over profits. We need policies that ensure every Floridian, no matter their income, background, or circumstances, has access to the care they need. And as a nurse and a union president, and now as a candidate for the Florida Senate, I've always fought for the people who needed me the most. And I will continue to fight for you. Together, we can build a healthcare system that reflects our values. And together, we can create a Florida where people come first, where healthcare is about healing and not profits. Thanks, everyone.